Erectile dysfunction is one of those conditions that men would sometimes have a difficulty in discussing with their doctors. They won't necessarily talk about it because it's a sensitive issue. And if we try and discuss it, sometimes they would avoid it and rather not speak about it. But we must understand it is as much a medical condition as many of the other things that we treat in urology. And it is definitely a thing that we can help most of our patients with. The definition of erectile dysfunction is that it's difficult to get or to sustain an erection sufficient for normal intercourse. And that can happen at any stage in a man's life, but obviously it's more prevalent in the elderly men. And normally the incidence will gradually rise, and as men gets older, by the age of 60, almost 40% of them will have some form of erectile dysfunction. The causes of erectile dysfunction varies from psychologic or other conditions as well as physical conditions. Psychological conditions might be something like stress or relationship issues. Sometimes medication that we take might affect the erections. And the physical causes of that is mostly to do with the blood flow to the penis. So that can be either by damaging the nerve supply that will stimulate the blood vessels, or the blood vessels itself, or the tissue in the penis that might not function well. The symptoms of that, as I said, is normally that the man will complain of not having sufficient erections to have a normal sexual relationship. And we would then do a physical examination to make sure that there's no other reason why he has got vascular problems. That means that there is no other blood vessels that's also affected. Because we know that men with erectile dysfunction has got a higher incidence of heart disease, as well as a higher risk of getting strokes later on in life. So we will normally examine to make sure there's not underlying high blood pressure, cholesterol, diabetes, all the other causes that can cause vascular diseases. If we exclude those, or if they are well controlled and treated, then we will look at the erectile function itself. And by treating the erectile function, we can give medication that can either be oral medication, like in tablets, and the best known for that is the sildenafil, which is Viagra, and there are 3 different medications that we can use for that. They've got a few side effects, but all in all it's very safe, and you can take it with most of your other medication. There are also injections that we can give, so we can also add injection therapy to the treatment for erectile dysfunction. And then the last physical thing that we can do is we can do a penile implant, which is not a thing that we do commonly, but we do most of the implants in this hospital, and it is a very successful operation in the men that does not respond to the conservative therapies. It is also important to understand that it is not only the end organ that we treat, it's more of a holistic treatment for the patient, because older men might also have lower testosterone levels, which will contribute to a lower sex drive, and that will also affect their erections. They might also have relationship problems or psychological problems that will affect their quality of erections. And we have to give importance to the other factors that can also affect erectile dysfunction. So a patient that presents with erectile dysfunction is seen as a whole, and we try to treat all the underlying contributing factors that will give him normal erections, but at the end of the day, give him normal sexual relationships again.